Good afternoon, everyone. Thank you for joining us. I'm San Francisco Mayor London Breed, here to provide an update with what is happening in San Francisco as it relates to the COVID-19, the coronavirus pandemic that we have been faced with here in our city and throughout the world. I'm joined by our Department of Public Health Director, Grant Colfax, as well as the Police Chief, Bill Scott, the Department of Human Resources Director, Trent Rohr, the Director of the Department of Emergency Management, Mary Ellen Carroll, and we will be providing some updated information today to help guide you through this very, as I said, unique challenge. I really want to start by thanking the healthcare workers, the people who are putting their lives on the line in the hospitals and working with people every single day, the healthcare workers, the nurses, the doctors, the support staff, the people who are showing up every single day. I've seen an outpouring of love and support from San Franciscans who are basically social distancing outside and giving hand claps and love to our healthcare workers. And so we really appreciate what you are all doing every single day to keep people safe. We also want to say thank you to our first responders, our police and firefighters, our bus drivers, our muni drivers, the grocery store clerks, so many people who are showing up to work to help provide help and support and assistance to others. What you are doing on the front lines means so much to us, and we truly, truly have a deep appreciation for your commitment to serving others during this pandemic. We all know that yesterday the county health officers in the Bay Area announced an extension until May 3rd of this stay-at-home order with new guidelines that definitely are, as far as I'm concerned, adding but also reiterating the importance. And I wanted to just continue to stress the need to practice social distancing, but I want to refer to social distancing as physical distancing. Because we cannot necessarily be physically close to one another, it doesn't mean that we can't pick up the phone and reach out to people and reach out to our neighbors and continue to do everything we can to support one another during this very difficult time, because the likelihood that this May 3rd date will be extended is possible. We already know that the school year for kids has been impacted tremendously, and we know that from some of the early reports that it looks like even though there are real challenges here in San Francisco, even though we are at 434 cases and sadly 7 deaths, it could be a lot worse if all of you weren't playing an important role by staying at home when at all possible. And just for clarity, we know that people may need to go outside and take a walk. They may need to walk their dog or jog with their babies or go to the grocery store. And what we're asking people to do is get the fresh air, get the exercise that you need, walking, jogging, or biking. But while you're out there, maintain your physical distance from people who are not in your household. I see friends all the time. And I desperately want to run up and give them a hug, my neighbors, but I don't do that because I can't. It's just a natural thing to want to have that kind of connection with people, but I also realize the importance of not only protecting myself, but protecting them. And so that's what this is all about. As much as our natural reflection is to give love and to give, support and to extend our hand, it's just really critical that we not do that at this time. And once we're over this, who knows, we'll be able to maybe hug anybody we want. You never know. I want to also just, talk a little bit about some of my very incredible experiences. As I mentioned earlier this week, I had a neighbor drop off a slip in my mailbox to ask or to reach out to say that they're my block captain, and as a result of being the block captain, they are there to provide grocery runs, pharmacy runs, and also I can call them or email them if I want somebody to talk to. And it was very touching, but it also made me think about so many of our vulnerable population. We've been thinking about this for a while. We know people have been doing this all over the city informally. I heard about another resident in the Sunset. Someone reached out to this person and basically realized that this person was a senior and couldn't necessarily leave the house, dropped off groceries, asked if they needed support, asked if they, first of all, asked if they spoke any other languages besides English, and provided this comprehensive outreach effort to basically support their neighbors. And I know there are so many people who are doing that, and we appreciate you, and we're grateful for you. And I want us to be able to take that to the next level. So today, I want to announce an opportunity for San Franciscans to get involved and to volunteer. People have been great informally, but there have been so many people who have said, well, my neighbors, I don't have maybe that vulnerable population. I want to do something. I want to get involved. I want to be helpful. And so the program that we are announcing today provides you with an opportunity to do just that, to help those who are seniors and are part of the vulnerable population, especially people who are living in isolation and who can't run the basic errands in order to get the groceries and the support and the resources that they need. The Department of Aging and Adult Services, under the direction of Shireen McFadden, who is with us here today, they have partnered with the Shanti Project and the Office of Transgender Initiatives to develop a program where you can sign up and we will partner you with a senior. And it's basically like you're gonna be responsible for caring for and taking care of that senior for the duration of this issue or this pandemic. And I think that what is gained from this is not only the ability to do something to help support others, but it could be the beginning of a long-lasting friendship. We know that so many of our seniors are living in isolation. They may not have family members who are there and available to them, and here is an opportunity for you to help someone who desperately needs help at this time. And so to get information about this program, you could either look on our website at sfgov.org, you can call 311, or you can call 415-355-6700. I also want to thank Mon Ami, which is an app that usually coordinates in-person visits with seniors who live in isolation, and so they've repurposed their app to adapt to what we're dealing with to help us connect people with seniors who are living in isolation. And this program is also important. A combination of Mon Ami and Open House and others have been really great in taking the initiative and already doing the work. And now we are going to expand upon the work that they are already doing in order to connect even more seniors to resources. So that's really our goal, and I think this is going to be an incredible opportunity for our city, and so if you are interested, please reach out to us. I also want to talk a little bit about some of our efforts, and Trent Rohrer will talk more about our hotel rooms, our shelters, and some of the things we have planned to help house our unsheltered population. And I want to just start by saying that I know that we have thousands of hotel rooms here in San Francisco. And I know that people are asking, well, why don't we just open the doors and let everyone who's homeless get access to a hotel room? And I wish it were that easy. I wish it were that easy to help people who unfortunately are struggling with addiction, people who are sadly struggling with mental illness. I wish it were that easy to just provide a place for them to be. And I want folks to understand that part of the challenge we're having here, we've already secured over 400 hotel rooms, and we're hoping to increase that number. And again, Trent will talk a little bit more in detail about the priorities and the purposes and how we are preparing. But I want to be clear that the capacity and the resources in general needed to provide the wraparound supportive services for many of these populations make it very difficult to just open the doors and allow anyone to walk in. And in addition to that, we don't have the ability to force anyone to stay anywhere. And so that also becomes a challenge, even with our shelter systems. It's going to continue to be a challenge, but we have a plan. We have a plan to talk about exactly how we're going to do a couple of things. Number one, deal with the challenges of our congregate living settings, places like our shelters and our single-room occupancy hotels. We know that if someone gets the virus and they live in an SRO where they're sharing bathrooms with others, we don't want to send them back to a location where we know they could infect others. We want to isolate them and provide them with a hotel room so that they can get better, and that's a real part of the goal of our program. But we also know that there are proactive steps we can take, and with our shelter system, we have identified a location to specifically help to thin out our shelter beds. Moscone West, which is right across the street from our Emergency Operations Center here in Moscone South, where we're located, will be a place where we have identified room for at least 400 people. And the goal is to thin out our shelter system so people aren't as close to one another as they are in our shelters. So we will start as early as tomorrow, moving people from shelters all around the city into Moscone West. There will be 24-hour services and support and food and resources and exactly the kinds of things that you need in order to manage a shelter system here in the city. So this is something, again, Trent will talk more in detail about. I also want to touch on something that came out yesterday about the budget impacts and the fact that, unfortunately, based on the controller's work and research around what's happening with the finances of the city, there is, of course, a huge hit to our general fund and a huge hit to our economy as a whole, and we can anticipate a budget deficit of anywhere between $1.1 and $1.7 billion over the next 2 fiscal years. That is going to mean really a hard blow to San Francisco, a hard blow to our services. And so as we are also spending money and dealing with this pandemic here locally in order to keep people safe, we also have to be mindful about what will happen if we are not financially responsible now, if we are not making wise decisions about resources and how we allocate things and prioritize things. We are going to be in a lot of trouble financially in this city, and so we are going to need to make smart decisions. We are hopeful that the resources we anticipate from the federal and the state government will be of help. But when you're talking about a 1.1 to a $1.7 billion budget deficit, that is significant. So let's be mindful of that. We know there's a lot of need now, and we are doing what we can to not only take existing resources as well as raise private sector dollars in order to help our small business community and others who are suffering. But this is going to be a tough road ahead of us, and we are working every single day to put together the resources and the people, and we'll have more to announce, just some more information tomorrow about our recovery plan and how we are going to start to develop the right task force that would allow for labor and business community and city departments and others to come together to begin to talk about the future of San Francisco, our recovery efforts, and what do we do once this pandemic has been lifted, because there will be a lot of people who are going to be suffering financially, and we need to get prepared for it, not only now, but in the future. The other thing I wanted to talk about is the census, and I actually did the online census, and it didn't take very long. I was surprised that it was so quick. I think it took me like maybe 5 minutes to just go online and put in the number and log in, and it was very simple. You can go to my2020census.gov or call 1-844-330-2020. And anything that we talk about today, you can also, if you have questions, concerns, 311 is a great tool to try and get information as well, or the city's website, sfgov.org. And let me just explain why it is so important for us to be counted. We don't know if any decisions to make changes to the census might occur in DC, but we do know that when we are counted, we count. So when you think about the $2 trillion stimulus package that is being provided to the entire country, our state and possibly our city could have a tremendous percentage of that packet based on the number of people that are counted in previous censuses. Like, so for example, people who were counted in the 2000 census. That's the data that's being used to determine population and other things and resources and how we get our fair share of the pie. And so this is really important. Every person should be counted. Every person, meaning whether or not you are a U.S. citizen, if you are part of our immigrant community, you are part of our San Francisco community. And this information will not be used against anyone based on their immigration status. The census is protected in that way. And so we know that this is a very challenging time, but we also want to impress upon people in this city how important it is for everyone to make sure that you complete your census information. You get that sent in as soon as possible. For those who are at home and who have access to the internet, you have no excuse. We need your help. We need your support. Please make sure you're counted. To the nonprofit agencies that have received funding to do outreach, definitely this is a great opportunity to work from home, to pick up the phone, to call people and to outreach and figure out ways in which people can be counted, because this will make a difference in how we continue to get the kinds of resources necessary to make sure that we get our fair share, and that's what it's about. So make sure that you complete your census. It is critical to the future of our city and our country. And so with that, thank you all so much again for all of your work. Everyone who's out there doing what we need to do to keep San Franciscans safe. We know that it's only been 2 weeks, and I know it feels like it's been several months, but hang in there. Take care of yourself, take care of your physical and mental health, and try not to snap at your kids too much. They can't help themselves. They are, I'm sure, feeling as challenged as you are during this time, and my heart really goes out to a lot of the families with children especially, and I know that this is a tough time. So many kids who are not able to stay in school and hang out with their friends and see their teachers. Just let's be mindful that we are all going through this together, and for one reason or another are experiencing a number of probably emotional challenges as a result of this. And so let's be patient with one another. Let's comply with social distancing. Let's try and set an example and continue to hold our heads up so that we can get through this together. And with that, I want to introduce Dr. Grant Colfax.
Good afternoon. I am Grant Colfax, Director of Health. Thank you, Mayor Breed. Today, in my update to San Franciscans, I want to thank everyone for their cooperation and everything they are doing to help fight the spread of the coronavirus. When you stay home, when you keep 6 feet apart from people during the times you must go out for essential reasons, and when you wash your hands, you are literally saving lives. These efforts are important, and they are not enough. We must redouble our commitment to slowing down the virus in our community, to protect vulnerable populations, to protect our healthcare system, and to make the best path forward for recovery. Some people have asked this week, is it working? Are we as a community in San Francisco and in the region flattening the curve? My message today for you is it is simply too early to tell. We know we are doing the right things, and the data tells us that staying home is the very best defense. But at this stage of the game, there are still plausible scenarios that our healthcare system could be brought to the brink and even overwhelmed. I don't want that to happen. None of us wants that to happen. That's why we are here doing everything we can to follow the science, data, and facts to drive our decisions. Yesterday, San Francisco joined with other Bay Area counties to extend the stay-home order until May 3rd. I know that this is very challenging. There are real, serious economic and emotional impacts, but these sacrifices are an investment in our future as a community and as a city. It's time to take a deep breath and get ready to stay home all month. The new order is much like the one that was put into place on March 16th. All San Franciscans must stay home as much as possible and only leave for essential activities, like getting food and medicine. Even then, we must stay at least 6 feet away from others if they are not part of our immediate households. You may go outside and take care of a pet or for exercise, so long as you do not congregate in a group and you must maintain at least 6 feet of distance between you and other people who are not part of your immediate household. Essential workers are still needed to help our community during this time so that people can buy groceries, get gas, do laundry, get prescriptions, travel for essential reasons, get essential health care, and other basic, important, and vital functions. I am grateful to our essential workers in the public and private sector for all they are continuing to do every day to keep everyone as healthy and safe as possible. The new stay-home order strengthens the previous one in some significant ways. Here are 4 examples. Social distancing, physical distancing, is now mandatory when people leave home. Use of playgrounds, outdoor gym equipment, picnic areas, and barbecue areas is prohibited. This is to remove the temptation to gather. Number 3, people who can work from home must do so. And number 4, essential businesses must put in place formal rules for physical distancing protocols to ensure proper sanitation, that people stay a safe distance away from each other. These rules and many others are detailed in the order, which is posted online along with updated frequently asked questions at sf.gov. Now, I would like to give an update on Laguna Honda Hospital. We remain very concerned about a growing outbreak there and are continuing to do everything we can to protect the health of residents and staff. This week, we received help from the California Department of Public Health, the Centers for Disease Control and Prevention, and other key federal partners. They are working closely with us on the current cases, contact investigations, and recommendations for improved preparedness and response going forward. With regard to testing, as of today, Laguna Honda has a total of 12 confirmed cases of coronavirus. 10 of the confirmed cases are among staff and 2 are among residents. Of staff, 7 have been in patient care positions and 3 are not. To date, 89 patients have been tested throughout the hospital. To date, 218 staff members have tested, either by Laguna Honda directly through the health department or through their own provider. As we speak, the Centers for Disease Control and Prevention, their experts are on site conducting thorough tracing and contact investigations, taking action now and providing us with an evidence-based, data-driven roadmap for aggressive action in the future. They are identifying and testing those staff and residents they are most concerned may have been exposed to the coronavirus. With regard to behavioral health needs at Laguna Honda, this is a very challenging time for staff and residents. We have added extra resources to support staff and residents coping with the impact of the outbreak. We have opened a dedicated phone line staffed by psychiatry clinicians who can provide emotional support to the residents in real time. This support is in addition to our regular clinical behavioral health services. We also have a behavioral health specialist on site dedicated to staff needs who is proactively reaching out to staff on the 2 units that have been impacted to provide support and coping mechanisms. The behavioral health specialist is available to all staff, and our clinicians will continue to reach out to provide services. Caring for our most vulnerable during this pandemic is some of the most intense and selfless work in the city. And I want to thank the staff at Laguna Honda, the residents, and their families for their forbearance, their resilience, and their capacity to be part of our response to this pandemic. I am there, the health department is there, and the city is there for them. With regard to CDC, the Centers for Disease Control and Prevention, and the California Department of Public Health, I am thankful for the support we have received from them as well as our federal medical partners. This is an ever-changing situation, and the ability to develop and share best practices and protocols will help us slow the spread of the virus, both at Laguna Honda and other residential nursing facilities in the city and the region. Again, I am most grateful for their support and expertise. The CDC, Centers for Disease Control and Prevention, has 5 physicians and scientists on site at Laguna Honda today. They are providing much-needed staff and strengthening the contact investigations, which is crucial to slowing and stopping the spread of the virus. They are also providing expert knowledge to assist clinical teams in the review of clinical protocols and guidelines, and any revisions necessary given the fluid situation. As we learn more, as we receive more data, we will adjust our response accordingly. The California Department of Public Health is providing expertise and guidance on infection control practices throughout the hospital through direct observation. They have made recommendations for improvements in environmental cleaning and in staff practices, which are being immediately acted upon by Laguna Honda staff and the Zuckerberg San Francisco General Hospital. And let me be clear, these experts have insights from around the country and across the world to help us do better in our local response. They have also joined the ongoing Department of Public Health discussions with other long-term facilities in the city to assess current infection surveillance and control planning. I look forward to their daily briefings and recommendations for both individual facilities and monitoring our system as a whole. We and I will continue to do everything we can to respond to the changing situation at Laguna Honda, and I will keep staff, residents, families, and the public updated. I want to remind everyone that we continue to focus our response efforts on slowing the spread of the coronavirus, preparing our healthcare system for a surge, expanding testing, supporting healthcare workers and first responders, and protecting vulnerable populations, including those at Laguna Honda. I am pleased to update that the 2 NEMS drop-in testing sites for their patients successfully opened earlier this week and have already started conducting coronavirus tests. We have also been identifying spaces in hotels and motels for quarantine and isolation purposes to protect people experiencing homelessness and living in congregate settings. We are seeking ways to allow shelters to practice physical distancing by adding more spaces for people to shelter. We have made significant progress, and Trent Rohr, Director of the Human Services Agency, will now share an update. Thank you.
I'm Trent Rohr. I'm the Executive Director of the Human Services Agency. The Human Services Agency is charged with providing housing and care in the city's disaster or emergency response, and in this case, of course, the city's COVID response. We activated our Department Operations Center 3.5 weeks ago on March 9th, knowing that the most pressing need was to set up housing and other options for individuals in response to COVID. The most pressing need we were charged with from the Director of Health was to ensure that there was a relief valve from the medical system, from the hospitals, for individuals who did not need to be there, but who still needed to be quarantined. So to that end, we recognized that the best way to do this would be to rent literally thousands of hotel rooms in San Francisco. And thanks to Mayor Breed's leadership early on, she joined me and Director Colfax in a meeting with the Hotel Council where we asked for their help. The Hotel Council and their members and other hotels stepped up by responding to our requests for quotes offering over 10,000 hotel rooms for this purpose. I want to walk through now with you all what the priorities are for these hotel rooms. I'm going to go slowly because this is important detail, and it's important that not only the press but stakeholders understand these priorities. It's important to note that these priorities are at the direction of the Department of Public Health. The COVID response to the city, of course, is a health response, and so we're taking our best guidance from the Department of Public Health in terms of their needs. So for the hotel rooms we're bringing online, the number one priority, as I just mentioned, is to discharge or divert individuals who need to quarantine because they are either COVID positive or have been tested for COVID and are showing symptoms. Divert them from the hospital or discharge them from the hospital when they don't need to be there. 95% of these individuals are homeless. The remaining would be individuals who live in congregate settings like single-room occupancy hotels and therefore can't quarantine on their own at their home. The next population that's important for hotel rooms are what we characterize or define as our vulnerable population, which are individuals who are aged 60 and older, or individuals who have underlying health conditions that make them more vulnerable to the COVID virus. The first priority among this population, of course, would be the vulnerable who are in our homeless shelters. As we move towards reducing the census in our shelters to create the physical distance required, we will be moving those vulnerable individuals from shelter into hotel rooms, provided they can self-care, meaning they can be in a hotel room on their own with a minimal level of support from the city and from our nonprofit providers. The third category of individuals that we're arranging hotel rooms for, of course, are our frontline health care responders. So these are our doctors, our nurses, our medical professionals who need a place to stay so they don't go home, potentially infecting their family and their loved ones. We can provide them rooms here to allow them to stay. In addition, unfortunately, we know that some of our frontline health responders they are exposed to the virus and they will be exposed, and so we have rooms set aside for them as well to be able to quarantine in hotels in San Francisco rather than quarantining at home. And then the last population that we're prioritizing for hotel rooms would be the vulnerable population as I defined earlier. Again, let me restate that. The vulnerable population under COVID are individuals aged 60 and older, or individuals who have underlying health conditions that make them vulnerable to COVID. So this population of vulnerable adults who are living on our streets, unsheltered, are also prioritized for hotel rooms. These individuals will, again, need to be able to self-care. In the event that they're quarantined, they will be in the rooms on their own with meals and support delivered to them. But they must be able to take care of themselves. The second response, well, before I move into shelter, let me give you some numbers because I know you will ask. To date, the city has entered into contracts with 6 hotels, providing a total of 479 rooms. The priority population for those rooms are the first category that I talked about, which are individuals being discharged or diverted from the hospital who are homeless and who are either COVID positive or have been tested. To date, we have moved 123 individuals into the first hotel. And we have, of course, like I said, additional rooms totaling 479. In addition, we have another 2 hotels totaling 576 rooms that we anticipate finalizing our contract at the end of today. So they will be online by tomorrow. And then we have discussions with 1 additional hotel, a large hotel of 1,500 rooms that we hope to enter into contract by the end of this week or Saturday. This brings the total number of hotel rooms for the population I described earlier to 2,555 by the end of this week. It's important to know people, media and other stakeholders ask what the target is, and it's difficult, like projecting the curve, projecting the medical surge and the timing. It's difficult to know how many rooms we will need. But we have set up a system where we're nimble enough to flex up to as many right now as 6,555 rooms. Say that again, 6,555 rooms. We're currently in contract discussions with hotels totaling that number. We're attempting to balance the need of the medical system and the need for isolating and quarantining and providing safe places for vulnerable populations. Balancing that need with, of course, the fiscal prudence that we need. We don't want to be renting 3,000 rooms that sit empty for a couple weeks, but we want to be flexible enough to be able to manage the medical surge as well as manage the need for our vulnerable populations, both in our shelters, on our streets, as well as in our single-room occupancy hotels. The second piece of our housing, care, and shelter role is, of course, creating the physical distance in our homeless shelter system. The CDC guidelines is creating 3 feet of distance in between individuals in our homeless shelters. We are moving to 6 feet in between. So what this means is that we need to move individuals from our existing homeless shelter system into shelters that we are setting up right now. As the mayor announced earlier, our first shelter that we will open up and be ready to transfer individuals into is at Moscone West. The capacity for this shelter is 394 individuals, again with 6 feet of distance, full meals, showers, televisions, entertainment, and other amenities will be at the shelter for individuals. It will be staffed by Department of Public Health, shelter health workers, as well as other nonprofit partners. And again, we'll be moving individuals from shelters, our existing shelters, into this facility tomorrow. We have 2 other shelter sites that we are currently negotiating with. I won't say the location or the names because we're not completed with the negotiations, but this will provide us slots for an additional 460 to 510 individuals. These 3 facilities combined will allow us to achieve that physical distance in our existing shelter system, as well as physical distance in the shelters that we are deploying over the next number of days, tomorrow, and then the other 2 most likely by the beginning of next week. Again, important to note that individuals who are in our shelter system who are vulnerable, age 60 and older, or health conditions, will not be moved into a new shelter. Rather, they will remain in their shelter, and we will arrange for transport to them to hotel rooms, provided they can self-care. If they aren't able to self-care, then they will remain in their existing shelter with the full support of the staffing that are on site currently. The last intervention that we are charged with deploying are the trailers that the state of California is sending to us through the State Department Emergency Operations Center for the state. That's 91 trailers that will be coming to San Francisco. In addition, we have secured an additional 30 recreational vehicles. We have identified a site and currently negotiating with that site to finalize the agreement and then to begin setting those up. We anticipate those being primarily used for individuals who need to isolate, but who have significant other needs, whether it's behavioral health needs, dealing with addiction, or other physical health needs that need to be staffed by medical professionals and need to be in an isolation setting, but aren't equipped to self-care in hotel rooms. Clearly, this response takes the entire city to cooperate. HSA alone is not doing this work. We're doing it in partnership with the Department of Real Estate, with our city attorneys, with the Department of Public Health, and in the case for, and many others. In the case for Moscone West, we can't thank John Noguchi, the Director of Convention Facilities in the city. Can't thank him enough for his leadership in offering up the space and for helping us set it up and deploy our resources. It's amazing every day the level of work, expertise, and partnership that's going on in the city, and there's no way that we as an agency could do this alone. There's no way a single department like health can manage this situation alone. That's all due to the mayor's leadership. Mayor Breed has been steadfast in her leadership and her guidance and deserves a lot of credit for the way the city has responded. Thank you.
Good afternoon. I'm Assemblymember David Chu, and I have been touring the EOC today. And let me just say a few things. First, I've been in touch with my legislative colleagues around the state on a very regular basis. And what has been apparent to all of us is the leadership of San Francisco and the Bay Area during this coronavirus we have been setting the standard. We have been leading the way. And I want to take a moment and just thank everyone who's been part of the emergency response and the public health response and the response to the economic challenges that we are facing. The decisions that have been made earlier here in our region and our city have been setting the gold standard. And I just wanted to come and thank you for that. And having a chance to tour the EOC, we have an incredibly sophisticated operation here with many moving parts. And I want to just thank the men and women who are part of this. I also should say, as the chair of the API Legislative Caucus, I know it's been mentioned before, but today is Census Day, and among all the many things that folks are doing, if we don't ensure that every resident in San Francisco is being counted, we are literally potentially jeopardizing billions of dollars of federal funding to our city and our state. And so I'd reiterate to make sure that not only are you making yourself counted, but please ask your friends and your family to ensure that is the case. And then on one final note, as the chair of the Assembly Housing Committee, we are working hard to ensure that there are statewide resources and we're moving forward policies that ensure that not only are we housing everyone who is currently unhoused, but we're working hard to make sure that tenants are being protected during this time, and that when we come out of this crisis, we are planning to keep people housed and doing all we can during this crisis. We have managed during this time period to do all we can, but there is obviously more that we can do. And I want to just take a moment and thank Mayor Breed and all of the leadership in the city for working closely with the state and with our federal government. Together, we will prevail. For all of our family members who are at home, stay strong. We will get through this, and we will come out the other side stronger than ever. Thank you very much.
Our first questions are for Dr. Colfax. This question is about mask guidance. Is San Francisco's Department of Public Health issuing mask guidance? And if so, when and where should people wear them?
So our health department issued recommendations for health department employees and first responders to wear masks. That was a recent announcement. The key to wearing a mask for these employees, for these teams, is to prevent transmission of the virus potentially from them to other people, including members of the public. In the situation, there is a window period, apparently, for some people at least, where they do not have symptoms, but could actually transmit the virus. This is particularly important in settings where there's high frequency of continued contact with vulnerable populations, such as in the hospital, in the emergency room, in our correctional facilities, and with our police officers and firefighters who are out there helping people every day. I also want to emphasize that, unfortunately, San Francisco, as with the rest of the region, as with the rest of the country, has a severe shortage of masks. I am very concerned about our ability as a health department to supply masks ongoing for people, and we are asking everyone to keep that mask that you receive as long as possible, until it becomes soiled. We need these masks for public health and first responder purposes. We are assessing, along with many other jurisdictions right now, with regard to facial barrier recommendations for the broader populations, and we will be continuing to look at that data, following the evidence and the facts, and any further recommendations, you will hear it from us with regard to recommendations going forward. Thank you.
Thank you. And a follow-on to that question from Kate Larson of ABC7. Should people be wearing homemade masks or a bandana? Do they serve the same purpose?
So at this time, there are not recommendations from the CDC with regard to public wearing of masks. Again, right now our focus is on protecting the healthcare, the people in our healthcare situations and who are engaging with first responders.
The next question is from Trisha Tahandi in the San Francisco Chronicle, and it pertains to the residents of Laguna Honda. Are all of the residents being tested, and in particular the residents of the South 4 unit?
So as I have said in my remarks, we have a team of world experts from the CDC assessing the situation right now, and I'm awaiting specific actionable recommendations from them. I will be debriefed today and every day going forward with regard to the recommendations. As soon as I receive those recommendations, we will implement them wherever feasible and wherever possible. Thank you.
Next question is from Ron Lim of the LA Times. Can you tell us how many hospital and ICU beds there are in the city, and how many are empty, and how many are filled with coronavirus patients?
So we have approximately 1,300 what's called medical surge beds. It's beds where people with medical conditions or surgical issues would typically go. We have 1,300 of those beds. We have approximately 200 ICU beds in the city at this time. We are working on a med-surg plan to expand that. The capacity of those beds has greatly increased because we have taken early steps to do things such as ensure that elective surgeries and anything that could be postponed was postponed. So our bed capacity is higher than it was before the pandemic started. And with regard to coronavirus patients in the hospital, I do not have those specific numbers at this time to share. But at this time, we are monitoring the situation very carefully. Thank you.
A question from Janie Har at the AP. She would like to understand testing in homeless shelters and the shelter worker population. Have they been tested, and have many tested positive?
So look, I have been really clear, the mayor's been really clear, I think across the country, local officials, mayors, and public health directors have been really clear. We need more testing capacity. We need more testing materials. I am so proud of our public health team, which has tripled testing capacity here at the health department from last week to this week. We have very short turnaround times, 24 to 48 hours, which is key for better understanding where people need to be, freeing up our hospitals if people do not need to be in the hospital. But right now we are focusing on looking at the number of swabs that we have with regard to our testing capacity. So very basic supplies that we need as well as people need across the state and across the nation are really the rate limiting step at this time. We are focusing, and we will continue to focus our testing efforts until we have more supplies on people who need the testing most. Those are people who are symptomatic with COVID-19 like symptoms, people who have been in close contact with those people, and our healthcare workers and first responders. I hope that as our testing sites increase across the city, and as our capacity in terms of equipment increases, that we will get the supplies necessary. But I am literally waiting for more swabs to do more.
Thank you. The next set of questions are for Mr. Rohr. This question is from Marissa Kendall of the Mercury News. How many people have been offered hotel rooms but have declined?
Again, Trent Rohr, Human Services Agency. The current and initial deployment of the hotel rooms were targeted 100% to individuals in the hospital to prepare our medical system to manage the medical surge. We have moved 123 individuals in. I believe in terms of the number that declined, it's less than 10. And again, 94% of those were homeless.
That speaks to the next question from Janie Har of the Associated Press. Of last week's 300 hotel rooms, how many have been filled by people who are homeless, and what is the remaining percentage from what population?
Yeah, as I said just now, 123 are the total number of rooms being occupied by individuals who are either COVID positive or are awaiting test results and who have no place to self-quarantine, moving from the hospitals to hotel rooms, and 94% of the 123 are homeless.
A question from John King of the San Francisco Chronicle. Will the hotels being contracted by the city to house first responders and the homeless be rehiring hotel employees to help attend to the new residents?
So it depends on the hotel. The city's desire is for hotels that are that can provide meals, have restaurants or kitchens, that we fully deploy those hotels to be able to provide meals to the individuals who are quarantined there. If the hotel does not have meals, we have to arrange for meal delivery, which is just an additional logistical step that we'd like to avoid. It's up to the hotel and the ownership on whether or not, and of course the employees, on whether or not they would like to remain. But it is our full intention that we have these hotels staffed with, again, kitchen staff, general lobby staff, housekeeping to do general cleaning areas, not room cleaning, and the like. It's vitally important. Of course, the primary goal is to provide a public health response that protects individuals, but secondarily, given the significant hits that our service and hospitality employees have taken, that to be able to employ them is an added benefit, of course.
Thank you. And a clarification from Michael Bott at NBC Bay Area, confirming that as of now, 23 individuals have been moved into the first hotel that came online?
No, 123.
Thank you. Next question is from Chris McGinnis at SF Gate. If a person in a household becomes COVID-19 infected and needs to be isolated from family, should they move into an SF hotel? Are there rooms set up for this type of stay, and at what rates?
That's more of a medical question in terms of how the health system should respond to families, so I'll defer to Dr. Colfax. So if there are other questions for me, I'll remain and let him handle that one when I'm concluded.
And just a follow-up from Mr. McGinnis at SF Gate, are you able to tell folks the name of the hotels which the city has or will soon have contracts with?
We've made the decision not to name the hotels, both for privacy of individuals who are placed in the hotel, as well as protecting and ensuring the negotiations moving forward with other hotels. So we will not be releasing the names of the hotels.
Thank you. The next questions are for Chief Scott. Chief, this is a question from Megan Cassidy at SF Gate. How many officers or sworn staffers have tested positive, and how many have been exposed or quarantined on your staff?
To date, we've had 2 officers, both sworn, test positive. And we've had 53 quarantined, and some of those officers are already back at work. But we've been very fortunate working with the Department of Public Health and the mayor and others who provided leadership early on. We hope that we can continue to see this good fortune that has come our way, because we have not been severely impacted at this point. Can't predict the future, but at this point, only two.
And a follow-on to that question from SF Gate. Do you have plans in place for if a significant number of first responders become ill?
Yeah, we do. I mean, we've seen other departments, unfortunately, across the country that have been severely impacted by this. We started at the onset of this with modifying some of our protocols. A lot of our administrative units and officers that work those units were rotating in patrol to supplement patrol. We've modified the patrol schedule, and we have several models that in the event that we have significant shortages of personnel, which right now we don't, fortunately, we have several models that we can go to. So depending on what those shortages are, there are different models. But we have modified our deployment greatly, including very limited activity at our academy in terms of training. All in-service training has been canceled. We have shifted some of our investigators to patrol duties. Some of our supervisors that work administrative and investigative units have been shifted to patrol duties to supplement patrol. We want to keep social distancing within our ranks in mind and not overcrowd our police stations as well. So we're trying to balance that. But yeah, we do have modeling for in the event that we have shortages.
Thank you, Chief. That concludes our press conference.